good afternoon. And at the onset, I would like to thank the APA India to have given me this opportunity to talk to you on this topic of constipation. I am going to talk to you about not much about constipation because there are many other lectures on constipation which I saw in the program, but I am going to talk more on the use abuse of laxative. If you see the market, there are so many types of laxative available that it's always a question in front of a young surgeon or a young physician as to what laxative he should use. So during this lecture, we will try to see what is the basis of using a particular laxative. As you all know, chronic constipation is one of the very common problem, and all of us we have suffered from all of us have suffered from constipation at some or the other time in our life. And if you open any type of media, it may be paper media, it can be TV, it can be cinema, it can be the social media, you will see so many types of advertisement which are related to laxatives and which are related to constipation. And in fact, if you go abroad and if you visit any supermarket, you will find one full section which is dedicated to all various products which deal with laxative. So all these mean that constipation is a very common problem which affects the mankind. Now, we have always grown up with this idea from our parents and grandparents that if you want to stay away from the disease, you have to be free from constipation. Okay, and this is the theme of this advertisement by Raju Srivastava, that pet safa to rog dafa, that if you get freedom from constipation, you would be free from any particular disease. So much so that this same idea of chronic constipation became a theme for one of the very popular movie by the name of Piku, where Amitabh Bachchan he acted the main role or the central role of a old elderly person who is chronically constipated, and he gets so much obsessed with chronic constipation that his whole life revolves around his tummy and nothing else. If you see around the world also, there have been so many famous personalities. You can see over here, you can see Adolf Hitler. You can see over here some Hollywood actors. This was one rapper. And you can see this actor from the very famous English serial Grey's Anatomy. Pete Sampras was the tennis player, and John Kennedy, he was one of the presidents of America. So all these famous personalities also, they suffered from chronic constipation and constipation predominant irritable bowel syndrome. So much is the prevalence of constipation that we should know as to what laxative to use for that particular type of constipation. So constipation is one of the most common gastrointestinal disorder which is encountered in clinical practice, and up to 1/5 of the general population suffers from chronic constipation during their lifetime. So before we go in for what is constipation, let us see what is a normal bowel habit. We have to know what is a normal bowel habit. So the time a newborn is born, in the first week of life, the child passes about 4 to 5 soft and liquid-like stools in a day. And once the child becomes about 3 to 4 months old, he starts passing about just 3 to 4 soft stools per day. And when he grows up to 2 years, this frequency comes to about 2 to 3 soft stools in a day. And once he crosses 2 years, he passes 1 to 2 form stool in a day. And usually for most of us, this frequency remains the same throughout our life. So most of us, we are used to passing 1 to 2 form stools in a day. And this remains throughout our life unless until we have some particular disease. So constipation doesn't only mean that there is an infrequent defecation, but constipation can lead to other problems also. It can lead to vomiting. It can lead to anorexia. The patient doesn't have an appetite to eat, and thereby he goes in for weight loss or chronic malnutrition. And patient can also have nausea, He can have a feeling of satiety, and that is why further the appetite is reduced. And sometimes, if the stools are very hard, it itself can lead to rectal bleeding because of chronic fissure formation. Now, diagnosis of chronic constipation is not very difficult. So the diagnostic criteria, they depend on what are called as the Rome 3 criteria. And the Rome 3 criteria, I won't dwell much details about, it's all given in the books, that any patient who has at least 25% of the defecations are associated with straining, with lumpy or hard motion, sense of incomplete evacuation, or if there is a sensation of anorectal obstruction, blockage, or if he has to do some sort of manual maneuvers to facilitate the defecation, all these they fit into the Rome 3 criteria for chronic constipation or chronic constipation predominant IBS. So before we go in for what is a normal stool, one should know something about the Bristol stool chart. So this is the Bristol stool chart, because the patient may not always be able to describe what type of stools he is passing. If you ask any patient that are you constipated, I think 80% or 90% of your patients would say that yes, we are constipated. And then you really don't know how to grade it. So you show them this chart. The Bristol stool chart is given on the net. It's very good. And from this Bristol stool chart, you can come to know what type of stool the patient is passing. So there is a one type of stool which are very hard lumps like nuts or like hard fruit shells, and these are very hard to pass. So this is a type 1 type of stool. And the extreme end of this, type 7, where the patient passes absolutely watery stool. There are no solid pieces in it. It is an entirely liquid stool. So this is extreme diarrhea. This is extreme constipation. Most of the normal population, or most of the people who claim, or most of the people who are going to have a normal bowel habits, are going to have somewhere in between. They are going to have either type 3 or type 4 or sometimes type 5 stools. So anything that is type 3, type 4, and type 5, that can be considered normal. And type 1 and type 2, they tend toward constipation, and type 6 and type 7 go toward diarrhea. Now, before we go in for laxative, one should know what are the common causes of chronic constipation. The causes could be neurogenic, and among neurogenic, the most common cause is diabetes mellitus. So if you see the patient of diabetes mellitus, most of them are uncontrolled diabetic mellitus, and they have their sugars around 250, 300, and they are carrying on with this sugar for a very long time. So usually we see that the patient visits his physician or a endocrinologist maybe once in a year, and after that he goes on continuing with the same medicine for many, many years without visiting his physician. And though his requirement might rise, he might be taking the same dose of medicine. And when he later on has some symptoms and you investigate, you will find that the sugars are somewhere around 200 and 300 and 400. But then they are not under control. But by that time, the damage is already done. The patient is already gone into autonomic neuropathy. And this autonomic neuropathy, which is associated with a uncontrolled diabetes, one of the very common causes of chronic constipation. Then other types of chronic constipation can be seen in patients who have a constipation predominant irritable bowel syndrome, which is a functional syndrome, something related to the brain and gut axis. Then there are so many drugs. I will just dwell in a moment about this. Then hypothyroidism is another common cause of constipation. And then you have idiopathic constipation, where you investigate the patient, everything turns out to be normal, and ultimately when you do a colonic study, you can classify them into a normal colonic transit constipation, or a slow transit constipation, or a dyssynergic defecation, what is nowadays called as ODS, that is obstructive defecation syndrome. Now, why I'm showing you this, that after diabetes, hypothyroidism is one of the common cause of chronic constipation. All of you know that hypothyroidism is very prevalent. It is very prevalent, especially in middle-aged females. And if you see the symptomatology of hypothyroidism, it is not only insensitivity to cold, or unexplained gain weight, or a dry skin, or thinning of hair, or menstrual loss, or muscle and joint pain, or depression. But one of the most important thing about Hypothyroidism is constipation. Okay, so if a middle-aged female who has other symptoms like weight gain, insensitivity to cold, fatigue, muscle joint pain, depression, puffy skin, thinning of hair, and if she has also constipation, I think she is a case of hypothyroidism. So these are all the drugs which are associated with chronic constipation. Various NSAIDs, analgesics are associated with constipation, antihistaminics, antispasmodic, of course, because by reducing the bowel movement, it will cause constipation. Most of the people who are having some sort of psychiatric disorders and are on some sort of antipsychotics or antidepressant, so some sort of psychiatry drugs, they would also have constipation because most of these drugs are centrally acting. They act on the CNS and they thereby depress the peristaltic movement of the bowel. Iron supplements, which are commonly given for anemia, are again they are strong constipating agents. So are aluminum agent, which are present in various types of commercially available antacids. So they are again constipating in nature. And then opiates, if at all they are given for terminal cancer or for intractable pain, they can cause constipation. So the one of the commonest opiate which is used in general practice is tramadol, and tramadol is known to cause constipation. Various antihypertensives, vinca alkaloids are given for cancer patients. Calcium channel blockers are very commonly used as antihypertensives and they are also constipating agent. So let us come to what are the indications for laxatives. And the basic indication for laxative would be chronic constipation. Now, this constipation would be of various etiologies. It could be because of old age. The patient could be bedridden because of some condition like dementia or Parkinson's or some other neurological condition. The patient could be unconscious because of a head injury or because of meningitis or because of some other stroke or cerebrovascular accident. Then anorectal problems like hemorrhoids, like fissure, fistula, various types of abscesses. Post-operative patient, because he is bedridden, he is on pain medication, he might be on NSAID, he might be on opiates. So he is again likely to have chronic constipation. So he is another strong indicator of using laxative. Post-MI, any patient who has suffered a stroke, a heart attack, or a stroke, they are always put on prophylactic laxatives because any sort of straining in these patients could again be detrimental and again could lead to a re-stroke or a re-attack. So that is why laxatives are must in these type of patients. Of course, if a patient has to undergo some sort of bowel surgery, some sort of endoscopy, especially colonoscopy or sigmoidoscopy, some sort of radiological procedure like a barium enema, in that case, all the fecal matter has to be out. So these patients, you have to prepare the bowel by giving them appropriate laxative. Portasystemic encephalopathy is another indication for using laxative because if the bacteria overgrows in the bowel, it leads to formation of ammonia, and more amount of ammonia would enter the circulation, and this will bypass the liver because the liver is already cirrhotic and not able to work. And this ammonia will now start acting on the brain and the patient would become comatose. So portasystemic encephalopathy is another strong indicator of using a laxative. And then physiological causes like a small child, pediatric patient who is especially undergoing a weaning, that is shifting from the mother's milk or outside milk to a semi-solid diet or a normal diet. So that's a time where the child is liable to have constipation, or a pregnant lady just because of the sheer presence of the fetus in the abdomen, because of the pressure of the fetus on the colon, she might be having constipation. So these are all the various very common reasons for constipation. Now, constipation doesn't only mean use of laxative. It means many other things. It means you have to change the lifestyle of the patient. Many of these patients, they have got a faulty lifestyle. So the lifestyle has to be corrected. So all the chronic disorders like, diabetes and myocardial infarct, heart attack, blood pressure, we all know that they are lifestyle related problem, and so is chronic constipation. So good amount of exercise, regular exercise, adequate amount of hydration, patient should consume at least 1.5 to 2 liters in a day. India is a very hot country, and especially in the summer when the temperature goes above 43 and 45, especially in central part of India, that's a time when the patient can very rapidly get dehydrated, especially if he's doing some sort of outdoor activities. And these are the people who tend to get constipated. So dietary modification, a lot of fresh vegetables, fruits, milk, adequate amount of water, regular bowel habits, eating habits, exercises. These all are very, very important, and they form an important part of the treatment along with laxative. A good toilet training is again very important. The patient should not be doing what is shown in this picture. Most of us, they go to the toilet, sit on the commode, and then start WhatsApping, seeing the messages and answering them, and go on sitting on the commode for half an hour, 1 hour, 2 hours. And there are some people who nearly spend at least about 4 to 5 hours in the toilet on the commode. Now, this is very detrimental. People have habits of reading newspapers, people have habit of reading books. So you can see one toilet over here where the person who is chronically constipated has built his full library in the toilet. Animals, as you know, the herbivorous animals, you can see over here, the hippo is never constipated. You all know the very fact that they eat a lot of fiber, they eat a lot of grass, and grass is all fiber. So because their diet is rich in fiber, the animals are hardly constipated. So this is one important lesson we have to learn from the animal kingdom. Now, since there are so many laxatives in the market, we have to understand how the laxative work, because that is going to tell us which laxative to use in which particular condition. So how to know which laxative to use? I think we have to first learn the classification of the laxative. That is how you can classify the laxative. And this classification is basically dependent on the mechanism of action of the laxative, that how the laxative is going to act, and that is going to decide the indication for that particular laxative. So this is the classification of the laxatives. So you have laxatives which are bulk agents, you have laxatives which are emollient, you have laxatives which are combination of emollient and stool softener, you have saline laxatives, then you have lubricant laxatives, you have osmotic laxatives, you have only stimulant laxatives, and then you have a type of laxative which is called as prokinetic. Now let us see all of these one by one, because that is going to teach us which particular laxative to use in which particular indication. So coming to the first type of laxative, that is called as bulk laxative. Now bulk laxatives are very commonly available in the market, and the most common bulk laxative which is available in the market is some sort of isabgula husk. So isabgula is a fiber which is of plant origin, and this is available both as a non-commercial form which is available with the grocery shop. That is what is the Lakshmi chap type of isabgol. And then it is also available as the refined form of isabgula husk, which is a micro refined and which is much better palatable. To make it palatable, they add some sort of sweeteners or some sort of effervescence to it that makes it more refined. So this is available with the chemist shop. So it is both as a non-commercial product as well as commercial product. Now these bulk laxative, they are basically, it's a natural fiber. So it's a fiber which is of plant origin. It's a natural fiber. And how does it act? They, when they are taken, they are in a micro refined or a small powder form. So when it is consumed, they go into the intestine, and once they are in the intestine, they absorb the water. So the water or the fluid which is there, which is present in the center of the lumen of the bowel, will be absorbed by this fiber, and this fiber will now start swelling. You all must have seen that whenever we tell a patient to consume the fiber, on his first visit after this after you have prescribed the product, he comes and he tells you, डॉक्टर वो पाउडर जो है हम लेते तो है लेकिन वो मैं पी नहीं सकता. Then you ask him why he is not able to consume it. He says that the moment I put it in water, after some time it becomes a thick jelly like thing and he cannot drink it. So this is a mistake which he is making. So So when you prescribe a bulk laxative, you have to tell the patient that he has to put 1 or 2 spoon of powder in a glass of water, or he has to put the powder directly in his mouth and drink it and gulp that powder with fluid. Now what happens is that this fiber immediately starts absorbing the water and starts swelling. So if you keep this powder in water for a longer time, it becomes like a jelly, and then it becomes difficult for the patient to drink it. Okay. So the correct way of using a bulk laxative is to either put it in mouth and gulp it with a glass of water, or secondly, if you're going to put it in water, just to put it in water, shake it once or twice and immediately drink it. So before it starts swelling up and turning into a jelly, the patient should drink it. So what happens is that it goes into the intestine, it absorbs water, and it swells. And once it swells, it distends the intestine. And you must have known in first year, we are taught in physiology what is called as a Frank-Starling's law. Now, what is this Frank-Starling's law? The Frank-Starling's law is applicable to almost all types of effort exercise. It is applicable to smooth muscles. It is applicable to skeletal muscle. If we have to build up our skeletal muscle, what we do is that we go to the gym. We go to the gym and we start gymming, and we start taking weights, and we start doing weight training. So when the muscle is put under stretch, the muscle contracts stronger. This is what is called as a Frank-Starling's law. This is applicable to both the smooth muscles and the skeletal muscle. So this bulk laxative, it goes in the intestine, it absorbs water and swells, and it stimulates the smooth muscle of the intestine. So the smooth muscle of the intestine now contracts stronger. So this is how the peristaltic waves, which are now generated in the small intestine, they would be much stronger. Okay. And plus also it acts like a jelly. It smoothens up, it adds bulk to the stool, and that is how it functions as a laxative. So the action will happen on the same day, but the action becomes stronger as the day pass. So maybe the first day, if you consume a bulk laxative, the effect would be about 25%. On the next day, it would be about 50%. And after maybe 4 or 5 days, it would be about 80% or 90% of the action would be seen, because the muscle contraction also has to build up. Okay. Now they are of usually plant origin. So the commonest fiber which is used of plant origin is psyllium, or what I already told you as called as isabgula or isabgol. And there are various trade forms or various pharmacological products available of psyllium. Then the second fiber which is available in the market is from the wheat or from the oat, and it is usually available as either biscuit in the biscuit form. You can get various types of digestive or multigrain biscuits, or in a bread form in the form of brown bread or multigrain bread. So whenever you consume the cereals as a whole along with the cover, that is whole wheat or whole oat, so the covering of that cereal contains the fiber. So that is what is called as a bran. Bran, I think in Marathi or in local language, it is called as konda. Then the third type of fiber which is available in the market is terculia, and by the name of normacol. It's not very popular. Then another type of fiber which is available is agar agar, and this is from a blue algae. That is algae which is a seaweed, or which grows underneath the water. So these are various types of fibers which are available, or the bulk laxatives which are available in the market. Now I told you that they are also non-commercial and commercial. The commercial form would be more refined. It would be micronized, because the fiber as such doesn't have any taste. It is tasteless, and many people have difficulty consuming it. So make it more palatable, so the companies, they add some sort of sugar to it and some sort of effervescence to it. So many of these are either lemon flavored or orange flavored, so that make it more palatable. So these bulk laxatives are basically indicated in all these patients with who have chronic constipation or as a prophylaxis. You can use it if a patient has a stoma, and through the stoma if he's pouring out a lot of liquid stool. So to make the stool more firmer, makes more semi-solid and more solid, you can add fiber to it. It is also indicated in patients with ulcerative colitis, irritable bowel syndrome, especially the diarrhea type of irritable bowel syndrome, where it will help to reduce the amount of the stool or to make the stool more firmer or to make it more formed stools. And it can also be used for condition where there is lipid profile is disturbed, like hypercholesterolemia. The bulk laxatives are usually used in a dose of about 20 to 30 gram at one time. So it comes to about 60 grams in a day. You can, that is the maximum amount you can take. Hmm. And important thing is that the patient should always take water along it. So 1 to 2 glasses of water along with a bulk laxative. This is one very common mistake where why the bulk laxatives are not effective. So many times what happens is the patient directly takes only the powder, he doesn't drink any water, and then it is left to whatever fluid is present in the intestine to swell the fiber. So if that amount of fluid in the intestine is not much, then the swelling will not be much and the bulk laxative will not be very effective. So that is why to make it swell, you have to tell the patient that he has to have 1 or 2 glasses of water along with it. So they usually take about 12-24 hours for action, and the action becomes stronger by third or fourth day. Now, they are contraindicated if a patient has some sort of hypersensitivity, especially if a patient has some sort of hypersensitivity like a celiac disease or a tropical sprue, where the patient is allergic to the wheat and the wheat products. Okay. Then they are also contraindicated if a patient has some sort of obstruction, either a stricture or a stenosis or a fecal impaction, because you know that the intestine is now going to contract strongly. And if there is a distal obstruction, then this intestine is going to perforate. So for the fear of perforation, we have to see that you don't use it in any patient who has any sort of obstruction, subacute or acute obstruction. Also, it is contraindicated in inflammatory condition like appendicitis, like cholecystitis, because in this inflammatory condition of the bowel, if you give a bulk laxative or any laxative of any sort, the inflammation is going to spread. Okay. So, and the classical, it is also again contraindicated in patient who have slow transit constipation, because in these patients there is some neurological disturbance and the transit of the colon is very slow. So in these patients, if you give a bulk laxative, this patient, they start getting bloated, they get a feeling of bloated because the the fiber cannot go across the colon because of the slow transit. And again, they are contraindicated if a patient has some sort of ulcers or strictures or adhesion. Now, since the patient has to take a lot of water along it, the patient always gets some sense of bloating. And if there is some sort of subacute obstruction, that can be precipitated. Now, they can also affect the absorption of drugs. So try to avoid them, to avoid drugs along with it. So if a patient has to take some drugs and a bulk laxative, there should be at least 2 hours gap in between the two. So he should first take the drug, wait for 2 hours, and after that drug is completely absorbed, then he should take a bulk laxative. They are quite safe during pregnancy because they do not set up any violent peristaltic waves, or they do not affect the uterine contraction. So you not only have natural laxative, but you also have synthetic laxative in the market by the name methyl cellulose. And these methyl cellulose, since it is a synthetic fiber, doesn't undergo any sort of fermentation. So there is less bloating or less gas formation. So this bulk laxative can be used for all those patients who are allergic to psyllium and uh, other vegetable fibers, or patient who have tropical sprue or celiac disease. So again, rest of the things are the same, that you have to have it with adequate amount of water. And again, they are contraindicated if a patient has some sort of obstructive symptoms. Fiber is quite safe during pregnancy. So if a pregnant female requires fiber, they are quite safe. Then there is another synthetic fiber by the name of calcium carbophil, polycarbophil. This is very uh, favorite in the West. It's not so easily available because it's quite costly, at least in our part of the country, called by the name of metamucil or benefiber. So this is calcium carbophil. It is a synthetic fiber. So there is no fermentation again. So there is no bloating. So it is very similar to methyl cellulose. So it is one of the product which is commonly used for constipation predominant IBS. Now we come to the second type of laxative, what are called as stool softeners. Now stool softeners are also called as emollient laxative because they soften the stool. And how they soften the stool? They have a soap like action. साबणासारखं action असते त्याला. So they have a detergent action though. So the moment they go in the intestine, they set up a detergent action, and this detergent action causes a foam action. It produces foam, and this foam will soften up the stool. This foam also covers the lining of the intestine, so it affects the fat and the water absorption. So whatever fat and water is there in the lumen of the intestine will not get absorbed, and that would further increase the liquidity, or that would further increase the liquid nature of the stool. So the commonest emollient laxative available in the market is Docosate by the name of Qsena or Dulcolax, and usually it's available both in tablet form or enema form. Roughly takes about 6 to 2 hours for the action. Now, it is an important thing what is called as tachyphylaxis. Tachyphylaxis is a phenomena where a body gets used to any particular drug, and the body starts requiring increasing doses of that particular drug. So this is a phenomena what is called as tachyphylaxis. So emollient laxative, they have a tachyphylaxis. So periodically, if a patient is regularly taking emollient laxative, he would start requiring increasing doses of the emollient laxative. So that is why these laxative are not very safe on long-term basis. A bulk laxative is safe on long-term basis, but emollient laxative is not safe in long-term basis. Now they can interact with many other drugs because they cause that foam action. So it not only affects the fat and water absorption, but whatever drugs are also taken along with it, they can be their absorption would be affected. So again, you should not be using it with any drug, and they are contraindicated in pregnancy. So this is one thing which you have to keep in mind. And most of the side effects of these laxatives are standard side effects like nausea, like vomiting because the stomach get bloated. They can cause colics because now the peristaltic wave is going to be stronger. So some of these patients, they complain of cramps or colics. And if there are a lot of loose motion, in that case, it could lead to dehydration. It could lead to electrolyte imbalance, especially loss of potassium, and it can lead to hypokalemia. So these side effects are nearly common to most of the laxative. Now there are some combinations also available in the market, like a combination of emollient with stimulant. Okay, so there would be a detergent action also, and at the same time something to stimulate the intestine. And the commonest combination is by the name of Qsena. So where there is presence of Dacacet along with Sena. Sena is one another drug which is a stimulant laxative. It is a casenthrol, and it stimulates the peristaltic waves into the small intestine. So you can also have combinations of laxative of this sort. Now, the next category of laxative is what are called as saline laxative. Now, these saline laxatives are basically salts. They are basically magnesium salts, so some sort of magnesium sulfate or magnesium citrate or milk of magnesia. So how they act? They cause osmotic retention of water. So since they are salt, a salt, as you know, that when you put salt in the water gets attracted toward the salt, and the salt dissolves in it. So they cause an osmotic retention of water. So that is why they can be used in acute constipation, but see to it that the patient doesn't have any sort of obstruction. So any obstruction is a contraindication for use of laxative. They take roughly about 3 hours for action because that's the time it requires to reach up to the small intestine. And if it is delivered rectally, it acts within 15 or 20 minutes. And sorry. They are again quite safe in pregnancy because they are not absorbed at all. Since they are not absorbed at all, they only act by osmosis. So that is why they are quite safe in pregnancy also. So the next type of laxative is what is called as a lubricant laxative. So we have seen bulk laxative, then we saw emollient laxative, and now we are seeing the lubricant laxative. Now, lubricant laxative, they act by lubrication. Lubrication means like a whatever, like a vangan or like a lubrication which is present in any moving part of an engine. So like you put grease or you put oil in engine so that the moving part, they have less amount of friction. So this lubricant, the commonest lubricant laxative which is available in the market is made up of mineral oil available by the name of liquid paraffin. Now, liquid paraffin is a petroleum hydrocarbon. It is, if you see, it is an inert viscous liquid. How does it act? It doesn't get absorbed at all. Okay, it doesn't get absorbed, or it gets absorbed to a very small tune. So that is why it remains in the intestine. And since it's oil based, it covers the intestine. It prevents absorption of water. So the water which is there in the lumen of the intestine remains within the lumen, and that keeps the stool liquid like. It lubricates it. Okay, so this is how is the mechanism of action of lubricant laxative. So these are again indicated in acute and subacute constipation, and especially they are very valuable in painful post-operative cases, like if you have operated a case of hemorrhoids or a fissure or a fistula, to take care of the constipation in the post-operative part. This is one of the commonest agent which is used, and it is usually used in about 15 to 45 ml bedtime. It can also be used as an enema also. Now, the main problem with liquid paraffin is that because it's a petroleum compound, it doesn't have any taste, or it has a very unpleasant taste. It's a very oily like thing. So many people do not like the taste of it, and some people they feel nauseated with the uh, with taking this type of laxative. Some people might have hypersensitivity. Now, if a patient is not very conscious, then in that case, the patient is prone to aspiration. So people who are on liquid paraffin and not very conscious, like patient who are terminally ill, patient who have Parkinson, neurological problem, dementia, stroke, etc. So these patients are prone to aspiration. So these patients should be avoided liquid paraffin. And since it causes coating in the intestine, it will affect the absorption of fat soluble vitamins and various types of drugs. So it should not be combined with that. And the commonest complication which is seen with liquid paraffin, as I told you, one is lipoid pneumonia because of aspiration. And second, if you give it on long-term basis, it can be absorbed into the wall of the intestine and it sets up paraffin granulomas. Okay. Now, paraffin is not absorbed, so it leaks out, and many times it leaks out, keeps the perineum wet, and leads to perineal itching. Then the next type of laxative, osmotic laxative. Now, osmosis means it not only keeps the water, but it absorbs the water from the surrounding. Okay, we saw that saline laxative or the bulk laxative, they absorb the water. In the same way, the osmotic laxative, because they have a hyperosmolarity, that's why they absorb the water from the surrounding, from the wall of the intestine. So these osmotic laxatives, the commonly used one is a poorly absorbed disaccharide, which is a combination of fructose and galactose. So the commonest available solution which is used is lactulose, and second one is lactitol. Now this lactulose is a combination of fructose and galactose. Both these sugars, the human intestine doesn't have an enzyme to digest these sugars. So both these sugars are not digested in the human intestine at all. Now many times these solutions are very sweet, or almost all these solutions are very sweet because ultimately they are made up of sugar. But they can be safely given in diabetic patient because this sugar is not absorbed and not metabolized in the human intestine. So that is why you can tell your patient. Sometimes the patient will complain, "Oh, doctor, I am diabetic and you have given me a sweet solution." So you tell him that your sugars is not going to rise with this sweet solution. So how does it act? Again, it binds to the water, it distends the colon, it draws the water from the surrounding wall of the intestine. Being a sugar, it undergoes fermentation. Okay, the bacteria which is present in the colon will act on the sugar, and that will lead to release of gases like hydrogen, like methane, carbon dioxide. So it will undergo fermentation. So that is why many of these patients, they complain of bloating, because the gas is produced inside. This gas is not one which he has swallowed, but this is something, a gas which is produced inside his abdomen. uh, and this hello. And this agent is very commonly used in patient with hepatic encephalopathy, because there we want to keep the pH, maintain the pH of the patient so that the bacteria doesn't overgrow. So lactulose is one of the commonest agent which is used in hepatic encephalopathy. The other types of osmotic laxatives which are available are sorbitol, mannitol. Mannitol was very common in olden days, but with the advent of lactulose, it has now gone in disrepute. Polyethylene glycol is another one compound which is commonly used. It's commonly used osmotic laxative, and it's available by the name of Peglite or Pegclear or Exelite, which is commonly used to prepare a patient for colonoscopy. So these osmotic laxative, if they are given in a small dose, they act as laxative. If they are given in a larger dose, they can be used for bowel washes and for bowel preps. So for preparing for colonoscopy, preparing for radiological procedures. So it is basically a dose dependent compound. Okay. Then the next type of laxative are prokinetic, and two common compound which are very popular in practices. One is tegaserod and one is prucalopride. So these prokinetic means they are stimulant. They stimulate the intestine so as to increase the movement, peristaltic movement of the intestine. So they cause what is called as an intestinal hurry or a colonic hurry. So they are peripherally acting also and centrally acting also. They act on the receptors which are present in the wall of the intestine, and they act on the receptor which are present in the CNS, and that is how they act. So they are again given, very popularly given in constipation predominant IBS. And again, the side effects and the contraindication are going to be the same. That is, you have to avoid giving it any patient who has subacute type of obstruction. Then the last type of laxative are what are called as stimulant laxative. The name itself suggests that they stimulate the peristaltic waves. Okay, they stimulate, they irritate the intestine, or they irritate the neuromuscular junction present in the wall of the intestine, and thereby the peristaltic wave or the contraction wave which is produced in the intestine is much stronger. And the type of stimulant laxative available in the market are bisacodyl, you have sodium picosulfate, you have cascara, you have aloe vera, alomax. So these are various types of stimulant laxative which are available in the market. And the most popular ones which are used is Senna, then bisacodyl and picosulfate. Danthron was again very popular in olden days, but it was found to be carcinogenic, so it has been now stopped. Phenolphthalein, which was present in the pink cremaphin, which was available about 10 or 15 years back. So earlier we had two types of cremaphin available, the white one and the pink one, and the pink one used to contain phenolphthalein. But this phenolphthalein, because if it is being a nephrotoxic compound, it has been withdrawn by the FDA, and now you don't get it at all. So this has been banned. So the only three or four one which are available are Senna, bisacodyl, and picosulfate. Yeah.
Mm, excuse me, Sharma sir.
And again, the side effects are going to be the same, but only one side effect you have to remember is that if it is given for a long time, it causes a blackening of the mucosa of the intestine, what is called as melanosis coli. So melanosis coli. So this is a very important endoscopic feature. So if this patient undergoes colonoscopy later on, you will find that the whole of the mucosa is quite black in color or dark in color. So that is what is called as melanosis coli. And if you see that, you can safely assume that this patient has taken a stimulant laxative for a very, very long time. Another stimulant laxative which is available in the market is castor oil. Arundel tail, okay, which is commonly called as Arundel tail. So how does it act? There is an enzyme lipase which is present in the intestine. So the lipase converts the castor oil into glycerol and ricinoleic acid, and the glycerol will get absorbed into the water, and the ricinoleic acid is the one which stimulates the small intestine, and it also decreases the water absorption from the intestine. So this is how it acts. And again, the problem are the same, that it can cause a cathartic bowel, that if a patient start consuming it on long term basis, the intestine becomes weaker and weaker, and over a period of time he will develop what is called as a cathartic bowel or a very slow transit constipation. It can affect the various types of nutrition absorption, because it forms a coating along the lining of the intestine. So all the vitamins and nutrients which are present, they are not absorbed properly, and over a period of time the patient starts showing these various types of deficiencies. And again, castor oil is quite unpalatable. It has a very unpalatable taste, and many people, they get nauseated or they are vomiting after this. Now,
Sharma sir,
one of
excuse me.
the, I think I'll have some just 2 minutes more,
Yeah, okay, thank you,
and
sir.
I will be finishing my presentation. So the last one important thing is laxative in pregnancy. You know that pregnancy is one physiological condition where the patient can get very much constipated, and this constipation is multifactorial. It could be because of the effect of the hormone, that is the progesterone. Progesterone by itself is a smooth muscle relaxant, and this progesterone, it acts not only on the uterus and relaxes the uterus to accommodate for the baby, but this also acts on the small bowel, and it reduces the motility of the small bowel. So constipation is very common during pregnancy. And second is the pressure of the fetus, or to accommodate the fetus in the pelvis, that itself compresses on the colon, that compresses on the intestine, so the bowel movements are reduced. Then many times a pregnant lady, her fiber intake is less, she is having nausea, she is having low appetite, she is tense, she is psychologically under pressure. So all these things, constipation is a multifactorial thing in pregnancy. So if at all the patient is constipated in pregnancy, first thing is that if possible, try to avoid it. Try to tell the patient to have dietary modification, adequate amount of fiber, some light exercises within the house, adequate amount of water. And in spite of that, if a patient requires some agent, the fiber and the bulk laxatives are quite safe in almost all trimesters of pregnancy. So you can give the bulk laxative or the fibers in any trimester of pregnancy. The lactulose, sorbitol, and senna are also quite safe. Uh, Polyethylene glycol is to be avoided because presently we do not have any FDA approval for the use of this compound in pregnancy. Castor oil is a big no-no. You should not be using castor oil at all, because it's a strong irritant, and sometimes it can cause strong uterine contraction. The patient can have abortion. The newer drug like tegaseroid, misoprostol, etc., we don't know the long-term effects of that, so they are to be avoided. Magnesium and phosphates are also to be avoided because of bad effects on the kidney and on the fetus. Okay, so having said that, having seen various types of laxative, like the bulk laxative, you have emollient laxatives, you have stimulant laxative, then you have osmotic laxative, you have saline laxative. Okay, various types of laxative. Now you have so much of choice that you can always choose the correct type of laxative for that particular indication. So just to summarize, in the end, I would just last few slides. The treatment of constipation, you have to investigate properly by history, by investigation, because a constipation can be anything. It can be a simple cause or it can be a sinister cause. So it can be a simple cause, just like a irritable bowel syndrome, or it can be a sinister thing like a malignancy. Okay, so always treat the basic cause. A fissure is a very common cause of constipation. So fissure can be effect of the constipation also, and fissure can be a cause of constipation also. So sometimes the fissure is associated with so much of excruciating pain at the act of defecation that the patient is afraid of going to the act of defecation. So he's afraid of going to the toilet, and he avoids going to the toilet, and that itself lead to hard stool, hardening of the stool because of desiccation. So a fissure can be a cause of uh, constipation or it can be an effect of constipation. So dietary correction, adequate amount of fluid intake, exercise, so all these lifestyle modification, good bowel training, avoid sitting in the on the commode with your mobile or with a newspaper or with the books. Laxative abuse is one of the most common abuse. This is something which you have to keep in mind. So never prescribe any sort of laxative on long term basis. The moment that particular indication is over, the laxative should be stopped. And most of the time, try to taper off the laxative. Don't stop it immediately. If you stop it immediately, there would be a rebound constipation. So that is why you have to taper off the laxative. And many of these patients have some sort of um, uh, uh, they have a background sort of psychiatric problem or a functional problem. They have some depression, anxiety disorder. So proper psychiatric assessment is also very important. So a good history, drugs like psychiatric opiates drug, we have seen so many drugs which are very commonly used in day-to-day practice, they can cause constipation. Medical causes like hypothyroidism, diabetes mellitus, chronic renal failure, they are also to be kept in mind whenever a patient comes with constipation. Now you have to always remember the medico-legal aspects of constipation is if you fail to identify an underlying colorectal cancer. I told you that constipation can be because of a simple cause, it can be because of a sinister cause. And colorectal cancer is something which is sinister. So if you don't investigate the patient, and if after 1 year or 2 years he comes with an advanced colon, I think that's not justified. So failure to identify an underlying colorectal cancer, overlooking an anal fissure in a constipated child. So a child might complain of constipation, but he cannot give proper history. Examine him well, he might be having an anal fissure, which might be leading to a chronic constipation. Misdiagnosing colonic ileus secondary to sepsis or intra-abdominal catastrophe and labeling it as constipation is another medico-legal pitfall. Misdiagnosing a large bowel obstruction as constipation and doing a surgical intervention for constipation in a patient who has an underlying psychiatric disorder. So these are some medico-legal pitfalls you have to keep in mind. There are many other novel drugs which are emerging on the horizon, and so many drugs are coming up in the market about chronic constipation. I think with that, I come to the end of my lecture, and I thank you very much. And